basic fertility workup looks at 4 different key aspects of a couple's inability to conceive. The first, very simply, focuses on the female. We like to do an egg reserve assessment, and that can be very simply done with blood draw. We look at a few different hormones. One in particular is called follicle stimulating hormone that's actually produced by the patient's brain. Another, more reliable, is called anti-Müllerian hormone, or AMH, and that's produced by the patient's ovaries. Together, those let me know about a patient's egg reserve, which unfortunately for women can decline with time. And so it's important not to rely on a woman's chronologic age, but actually look at her hormone predictors of her egg reserve and ovary health. A second predictor of a couple's infertility that we do in an initial assessment is actually looking at an ultrasound transvaginally of the patient's ovaries and uterus. Oftentimes I can find things, so a small ovarian cyst or a benign fibroid that might be blocking ability for the sperm or egg to transport through. A third test actually looks to test the tubes directly with a simple internal X-ray. This is called a hysterosalpingogram, or an HSG. Now, full disclosure, it is a bit crampy, but we like to pre-medicate patients and get them through that exam. It can be so informative to let us know about the shape and size of a patient's uterus and to determine if there's a tubal blockage. Lastly, I evaluate a semen analysis. And so not my patient's favorite exam, but we actually look at a sperm specimen from a patient's spouse and look at the count, the motility, which can be the movement of the sperm, and also the shape and size of the sperm to determine if it's normal and has a high likelihood of fertilizing an egg. The workup that I've just described, looking at 4 easy steps: ovarian health, tubal function, ultrasound findings for shape of the uterus and ovary position, and last, semen analysis, in 90% of patients can predict the causes of their infertility. For about 10% of patients, though, the workup may be completely normal and yet a cause is not found. And these are a grouping of patients who we diagnose with unexplained infertility. That's very frustrating. Patients of mine who have unexplained infertility are very frustrated that there's not more information about exactly why they have failed to conceive at this point. But the good news is many of our low-tech solutions can help that patient population to conceive, and often they're very highly successful before we have to move towards something more aggressive like in vitro fertilization.